And then we'll, okay. Well, first of all, don't get overwhelmed by this picture. I do not require you to memorize this picture. So what you can see here, okay, you have two pathways. One is the intrinsic pathway, one is the extrinsic pathway. The intrinsic pathway, because it only require the factors or chemicals in the blood. But here, extrinsic factor require factors in your blood vessels. So here it says the tissue factor. That's why we call it extrinsic factor. It requires tissue factor for converting the factor 7 to 7 to A. In here, I want to repeat something. In my previous slide, I told you that okay, there's a zymogen being activated to become an active enzyme. This active enzyme convert prothrombin into thrombin. So this active enzyme is called XA. So not XA, 10A, sorry, factor 10A. The zymogen is the factor 10. Not only that, I want to talk about hemophilia, briefly about hemophilia here. Hemophilia is a genetic disorder it affects approximately 1 out of 4,000 to 1 out of 5,000 men. And then we have two types of hemophilia. Well, I'll say more than two types. Okay, I'll tell you three types. Okay, I'll tell you three types. Okay, the common one, they are the hemophilia A. Hemophilia A, the genetic disorder causing hemophilia A does not have factor A. Hemophilia B causing the patient lack of factor 9. 9 is this, I believe the Roman numeral, this is 9, okay? There's one type is called factor 7 deficiency. I better write it completely, yeah. Factor 7 deficiency. Factor 7 deficiency is not as serious as hemophilia A and B. Factor 7 deficiency, it's said that approximately 1/3 of the patient shows no symptom. Um, the other 2/3 of the, well, hemophilia, basically they cannot stop bleeding, okay? But for this factor 7 deficiency, 1/3 of the patients do not show symptom, 2/3 of the patients show symptom, but they are not as severe. They're not as serious. They're not as severe as hemophilia A or hemophilia B. So in factor 7 deficiency patient, they get bruises easily. They also get nose bleeding easily. For women, they may have a prolonged period, and when they give birth, when they have a parturition, okay, something that you learn, when they have parturition, the bleeding also may take longer time to stop, but the bottom is that they can stop the bleeding. So as you can see that in here, hemophilia lack of factor 8. Where is factor 8? Here. I better use another color. Hemophilia A, lack of factor 8. Ooh, very dark. And then hemophilia B, lack of factor 9. Factor 9 is here. So as you can see that factor 9 is important because factor 9 can become factor 9A, and then factor 9A convert factor 10 to become 10A, and 10A is the one that activates thrombin, and thrombin is the one that activates fibrin. Now you know why. And 8A also involved into this pathway to convert 10 to 10A, and that's why hemophilia A and B, when you don't have factor 9 and factor 8, it affects the activation of 10A. You may not be able, but you what about factor 7 deficiency? Factor 7 deficiency, yes, it also involved in this conversion in the 7A, and it can also affect this one. But how come only 1/3 of the patient do not show symptom, even though the 2/3 of the patient they show symptom? It is not as severe because the factor 7A, factor 7 patient with factor 7 deficiency, they still have the factor 8 and 9. So as long as they have factor 8 and 9, it's not that serious. Treatment is very straightforward. If you are hemophilia A, doctor will give you factor 8 so that you can inject it to your body when you bleed, when you have bleeding. If you are hemophilia B, doctor will give you factor 9. Yeah, so that you can carry it with you. Then if anything happens, you can inject factor 9 to your body. If you are factor 7 deficiency, then of course doctor will give you the factor 7 to carry with you so that you can inject it in your body to stop bleeding. Okay, so that's my brief overview of the hemophilia. Oh, I forgot to mention in the previous slides. Okay, in the previous slides, a lot of this protein, a lot of the factor, all these factors, they're protein, okay, because they are enzymes that activate another factor and the enzyme. A lot of these, they are made in liver, and in the liver, they make all this plasma protein. Remember in the last lecture, at the end of the last lecture, we talked about a tissue edema. We said that the causes of tissue edema can be because you have the liver disease, because liver make a lot of plasma protein, and one of the plasma protein liver make is those of blood clotting factor. Okay, and liver need the vitamin K to make these plasma protein. Example, blood clotting factor. Those 10A, 7, and so on and so forth. There are three mechanisms to limit clot formation. Okay. Remember, we have this pathway, we have this reaction, prothrombin is being converted to thrombin. And the blood clotting factor or the enzyme is the 10A. And then there's something called tissue factor pathway inhibitor. Tissue pathway inhibitor, tissue factor pathway inhibitor. That inhibit this 10A. So the previous figure that I do not require to memorize, you see that all the complicated pathway, they are induced, they are activate, they activate. But this tissue factor pathway inhibitor, they, as the name suggested, it inhibit the 10A. So when it inhibits 10A, then there will be no blood clotting, no formation of fibrin. Yeah. So this is the second mechanism that can limit the blood clot formation. As you can see that in here, oops. What happened is that endothelial cell, you may assume that this is your inside your blood vessels. Endothelial cell, the simple squamous epithelium, you can find it in the innermost layer of your blood vessels. They have something called thrombomodulin. Okay, thrombomodulin, as the name suggested, it is basically a molecule that modulates like control or changes. A molecule that modulates thrombosing. A molecule that modulates thrombomodulin. So how does it work? Well, very straightforward. This thrombomodulin combined with thrombin, okay, not thrombosing, thrombin, and then they form a complex. This complex can activate protein C. Okay, this is not protein kinase C or phospholipase C, this is protein C. So don't mix up all three. Protein kinase C is the remember at the end of the endocrine system we mentioned about the second messenger cascade. We have two second messenger cascade. I gave you the two examples for the second messenger cascade. The first one is the cyclic AMP pathway. The second one is called phospholipase IP3-DAG pathway. And then at the end of that pathway, it activates something called protein kinase C. So this is called protein C, not protein kinase C. To mix up the two. And then protein kinase C can inhibit factor 5A and factor 8A. So these, you don't need to memorize that. I will not test you in the exam, but I just want you to know that these factors, they are the upstream factor to activate 10A. Remember 10A? 10A is the one that you need to memorize, factor 10A, because factor 10A is the one that convert prothrombin into thrombin, okay? Prothrombin into thrombin. So so it is the thrombomodulin thrombin complex. C part the third mechanism to limit blood clotting is something called anti-thrombin 3. AT3. So usually people inject this anti-thrombin 3 with heparin. So anti-thrombin 3 is very straightforward. Okay, the name already told you the function. It inhibits the thrombin. Okay, but what about heparin? What's the function of heparin? Some of you who work in the a hospital or clinicals or work in a clinic, you guys may know. I actually have some students, they know. They said that it's the blood thinner. Correct. This is the blood thinner. Remember, I told you that I have a car accident in 2016, March 2016, and I was hospitalized for 2 days, 1 night. While I was lying in bed, the people, they put a cuff into my leg, into my leg, so that the cuff connects to a machine. The machine will rhythmically inflate and deflate the cuff. So both of my cuff, they have this cuff, and they are connected to the same machine that will automatically and rhythmically inflate and deflate the cuff, so that it is literally a massage to my gastrocnemius, something like that. They do this because it is like I told you before, when you take a long international flight, you better do some exercise to contract, relax your leg muscle so that you can pump the blood. This is exactly the same idea. But instead of you actively contracting your leg muscle, a machine just do it for you. Okay. And not only they do this to make sure that I have good circulation. Once in a while they will give me an injection. I don't know what is that, and I didn't take a look at my watch to time it this time, because I told you that after a car accident I have a concussion and amnesia. Yes, that's why sometimes your professor says some things. Well, some people think that it is funny, some people think that it is stupid. Okay, just forgive your professor, because the professor has a previously he has a concussion. So that's why your professor is so funny. Anyway, um, so I didn't time it, so I don't know how often, but I know that once in a while they stick a needle into my body and it hurts, and I actually asked them, what do you inject into my body? Then they said, oh, it's heparin, it's for blood thinner, because they thought that because I lie in the bed for 2 days 1 night, and they worry that I'll have blood clotting forming, so they just inject the heparin to me, into my body. So yeah, this is a blood thinner. This inhibit thrombin. Okay. So oh, okay. This is the step 4. Okay, I told you that step 1 is the vasoconstriction. Step 2 is the platelet plug formation. Step 3 is the clot formation. Clot formation is mainly the fibrin. And then step 4, this is step 4, is called clot dissolution. Well, of course, I mean, after your wound is healed, your body need to have a mechanism to dissolve the clot. Mainly is use this mechanism is mainly plasmin. As you can see, the plasmin is also from a zymogen called plasminogen. So you learn about fibrinogen, you learn about plasminogen. Yeah, if you have started or if you have already watched my digestive system lecture, you learn another zymogen. It is called pepsinogen. So from my physiology class, you will learn 3 zymogen. Okay, fibrinogen, plasminogen, and pepsinogen. So plasminogen, okay, fibrinogen will be converted into fibrin to form a clot. Plasminogen will be converted into plasmin to break down fibrin, to actually dissolve fibrin. Yeah, to dissolve fibrin. Basically, clot dissolution, you just need to know that, okay, plasmin is the one that do the dissolving the fibrins after your wound is healed. Okay, so that's pretty much it. That's the end of the cardiovascular system.